Hello, it's Jane RVN. So we have some more OSCE tips. So we have gloves, we have gown, it's close gloving. One everybody hates, but you know what? It's not going to take you the whole 6 minutes. If you make a mistake, you say you've broken sterility, you can start again. Actually quite a nice little task. Again, we want clean hands, we want no jewellery, and the key for this one is fingers stay inside the cuffs. Obviously you can see fingers, but you're not poking them out, keeping them inside. This is a disposable gown, so if you've got spare ones at work or one that's been used that isn't covered in anything naughty, you can buy that or take it home, borrow it. These are cheap to buy from work as well. Sure, you can all fork out for these so that you can, you know, spend a couple of quid, get some practice in. So you're going to get presented your gloves as you would do from the examiner. Breaking sterility, get rid of that so that it's out of the way. I'm going to do what I did for open gloving. So I'm going to open, and actually, as you can see, the fingers are pointed towards me, so that's exactly what I want. So I'm going to lay it flat. Tip for these, when you're getting the paper down in the gloves, I get rid of the cuffs and I just use my forefinger in my gown because it's thinner. So I'm going to pull that flat like I did before. I'm going to open this bit of paper, flatten that down. I'm going to do the same here, open that bit of paper. It's giving me a nice working area. And then remember, we've got right hand here and left hand here, so you are doing a little crossover. Now I'm going to move my hands back and I'm going to break sterility again and show you. I'm going to do my hands like this, a little pincer, and I have it finger in here and thumb in there, so that's where I've got it. Some people manage to do it like this, so it's all in here. This is the way I prefer it. Either is fine as long as you keep your fingers in. So we can touch anywhere on the inside of the glove, so that's good. So I've got this whole big bit at the top here for you to do. If you try and grab at the bottom, the only thing I find is it's not as easy to guide your hand into the hole. You want to make this easier on yourself, so I pinch quite near the top of the fold. Show you that, and then I'm turning it over. Now the reason I'm turning it over, let me do that again properly. The reason I'm turning it over is to give myself a nice working area. My fingers aren't flapping, but also now you can see, because I've picked up at the top, the hole for where I want to put my hand in the glove is very close to the hole where it's going to pop out of my sleeve, which is very nice. So again, I can pick up anywhere here. I tend to pick up quite close to the top, and then I want to position fingers so they're going to come. Sorry, I'll do that again so you can see. I've got it here. I'm going to pick up at the top so you can see that. I'm going to push hand, because now if my fingers pop out, it's in the glove, so it's absolutely fine. I'm having a little wiggle because I want to feel where my fingers are going to go. The important thing is I'm also not continuing to pull down the hand. Pull it over your cuff and stop, because I've got space for my fingers to wiggle. I've got space where I can move, and you can see that I'm moving my cuff down out of the way so that I'm going to get my thumb in the right place. Oh, in fact, my thumb's not going to go in the right place, but I've got a sterile hand and I've got it over my cuff. I can sort out my thumb later. It's not a problem at the moment. Don't want it to flap too much, but leave it like that. Because again, what I'm going to do here is I'm going to touch only the inside, pick it up at the top, turn it over gently. And what have I got here? I've still got a thumb that's going to work. It's just not in its thumb hole, so that's fine. But what I like to do here, put your hands under. Oh, sorry, so you can do it again. Put your hands under, because then all you need to do is put your hand through. Now, again, don't pull it down massively. Give room for your hands to wriggle around. Hold it here. Double check that you've covered all of the white with your glove. And in fact, have a little look. Yeah, I'm going to pull down just a touch further just to be sure I have. And then I'm going to let go. Okay, this doesn't look pretty, but do you know what I've got? 2 sterile hands. So I can touch glove to glove, and I can pull my glove up, I can take my cuff out of the way. So I've now got a lovely hand. I can do the same here. I can pull my thumb up, give myself a bit of room. And then when I'm moving down, I'm not going back to the sleeve. I'm not going back to the cuff. I would go to the white cuff and pull down, and the white cuff and the white cuff. Because then there's definitely nothing to say I have touched outside of the glove area. You don't know how strict they're going to mark this. I don't want to go back and touch my sleeves. This is all I want to do. Hands together, clasp, clasp. You know, make it look lovely. You'll note that my fingers are a bit stumpy, but I've gone for half a size bigger. Do that in your exam. It's going to give you a little bit more leeway when your hands are a little bit enlarged or a bit sweaty. You take your own gloves, so take ones that are the right size for you, a brand that you like, whether they're powdered or not powdered. Anything is fine for you. Thanks for watching.